everyone. Welcome to the Glow Podcast. I'm here today with a very exciting guest. I have Jason with me. And for those of you just joining us for the first time, we are Tailored Marketing and we help aesthetic clinics grow their practices and scale their businesses. So if you're interested, drop a comment below. Jason, thanks so much for being here today. We're super excited to have you. So if you can kind of just go ahead and give a little bit of an introduction to the audience, that would be amazing.
Sure. I'm Jason Mazda. I am the editorial director for Dermatology and Aesthetics for Bryn Mawr Communications, which is a subsidiary of US Health Connect. And we publish Modern Aesthetics and Practical Dermatology magazines.
Awesome. Yeah, that's super cool. And so what kind of got you started in this industry, and what's a little bit of your background and how you kind of came to this place in your career?
Sure. So I'm only a little over a year into this. So I worked for about 8 years in daily news at a daily newspaper. Probably almost 11 years in dental publishing previously. Just some things with the company I was at just led me to look for a change and found dermatology and aesthetics and really have not looked back. Like I said, I'm a little over a year into it and feels like it's been much longer. I've been privileged to travel to a lot of conferences and just meet so many people, and the industry is just so interesting, so friendly, and I'm just really enjoying it.
Yeah, no, that's super cool. And so how was that switch kind of from the dental industry into more of the dermatology and aesthetics industry?
It was interesting. I mean,
Yeah.
number one, I went to our company hosted one of the conferences that we host is the Tell All Tribune Aesthetic Think Tank, and I went to that on my third day. Just getting to first of all, just getting to see the style of so many people in this profession. I think I was a little bit, I was wearing a suit, but I was still probably a little underdressed there, and then just some of the fascinating work that aesthetic professionals do, in particular at that conference that I got to see, whether it was videos of facelifts or whether it was just seeing everything that goes into some of the neurotoxins and fillers that are being done. And then as I've gotten into both dermatology and aesthetics now, the medical dermatology side, just learning about all the drugs involved has just been super interesting. Just very different from what I was doing before, and seeing just mechanisms of actions of drugs and everything that goes into drug development and all the potential for a lot of these therapeutics and where we're going. Just been really, I've enjoyed it a lot.
Yeah, no, that's super cool. Yeah, it is a little bit of a shift, but I feel like, yeah, you can learn a lot, especially like what you're doing if you're going to conferences and everything. That's super cool. And so, with practical dermatology and modern aesthetics, both of them kind of are providing practical content. And so, how does this kind of balance between obviously speaking to the doctors and then also speaking to the patients and consumers and how they can kind of use this for everyday use?
So we our primary audience is clinicians. I say
Okay.
clinicians, and that's inclusive of nurse practitioners and PAs. And so that's our primary audience. That's who we're targeting. With that said, obviously our websites are not gated or anything. So modern aesthetics in particular, we get a lot of consumer traffic. And the way I kind of look at it, what I always keep in mind, we always keep that in mind.
For sure.
There are obviously a lot of medical resources online where they're specifically only available for physicians, and we're always going to keep that in mind. But it can't hurt for consumers for the most part to see some of this, whether it's aesthetics and our articles about making filler great again, and how filler fatigue doesn't need to be a thing if filler is used really strategically and really tactfully and skillfully, and then on the medical derm side, and aware everything from awareness of the latest therapeutics. Some of the transformative drugs are still not, even close to market saturation, really. And then even, skin cancer and that kind of stuff. We're often addressing the clinicians about how they need to address patients. So So it doesn't hurt if consumers find their way to that content.
Yeah, no, that definitely makes sense for sure. And so obviously you have two magazines. So how, and you also mentioned obviously you have kind of information on the website as well. So with it being such a digital age, how have you all kind of made that shift?
I think it's happening across not only publishing, but a lot of industries, obviously. But I think there's still an appetite for print. I mean, I know there's still an appetite for print from our market research and people that I've spoken to. And I think it also, I think our print publications continue to lend us credibility for our digital offerings. With that being said, we're doing more and more digital every day. Whether that is just articles and more articles, digital affords us the opportunity to take something that might have either just not made the cut at all or might have needed to wait 6 to 8 months for publication, and we can put it up there because we're not limited by X number of pages in print. And then obviously the multimedia content has been a lot of fun to work on. We're doing a lot with videos. We are just getting back into podcasting, which has been fun. But, videos, it's engaging. It's how a lot of people want to consume their content these days. So, oftentimes a 3-minute video with two doctors discussing a specific topic might be the best way to get a certain message through as opposed to maybe a 4-page article. So it's been a lot of fun. And we're, the possibilities are endless with it.
For sure. Yeah, no, definitely. And so with like the podcast, would that be doctors talking or who would be kind of talking on the podcast?
Yeah, so the Practical Dermatology podcast has a clinician, a main clinician interview in every episode, and that's our chief medical editor, Dr. Neil Bhatia, and our associate medical editor, Dr. Lisa Swanson, take turns doing interviews with various leaders around the field. And then we also have a second segment that's an interview with me or one of our internal team and another doctor. And then we have one of our internal team members read some news items as well. So it's a little bit of everything, and we're seeing how it goes. We've rearranged some things on it, and we're continuing to just kind of fine tune it.
Yeah, that's super cool. I think podcasts, honestly, they've grown so much in like the past 5 years, and it's honestly just such a cool concept too, because obviously social media is great as well, but podcasts just seem a lot less curated. You can hear somebody talk, an expert talk about a subject for up to like an hour, however long the podcast is. An hour sometimes can be a little long.
I think, honestly, I think the fact that it's not necessarily, I mean, my recollection is like years ago when podcasts were first coming into prominence, it seemed like most of them were a standard hour or even a half-hour standard. But it seemed like there was like a standard that if you were going to be on, whatever podcast platform, it was like, typically it was almost like TV programming, it was going to be a half hour, an hour. And I actually think that the opportunity to have shorter pieces is really nice, to not be bound by, I'm always able to tell our doctors when we're recording interviews that, like, here's some bullet points we'd like you to cover, some suggestions, but really, take this conversation where it goes. And if that's 8 minutes, if that's 20 minutes, a half hour, whatever. And we kind of have that freedom to do that. And I know myself as a consumer also, I know that I really enjoy being able to listen to some shorter podcasts sometimes that are just kind of not trying to stretch things, not trying to fill a certain amount of airtime. It's good to have that freedom, I think.
Yeah, no, I completely agree with you. I think it shouldn't be like, okay, we have to go for an hour, but it's more of, okay, let's talk about these certain things. Let's see how it goes. If we want to talk about more, then we can.
Yeah, exactly.
Yeah, super cool. So in the beginning, you kind of talked about the think tank and the conferences that you all do as a company. So I would love to kind of hear just a little bit more about that and have you speak to those a little bit more.
Yeah, so the Tell All Tribune is an aesthetic think tank. Last year, it was the first year that we did it. It was invitation only, so we had somewhere around I think a little less than 50 faculty, and the faculty. We had short presentations on stage followed by long group discussions with the faculty seated at round tables and contributing. So not every faculty was on the podium. There were people whose main contribution was these group discussions. And that's kind of the idea, is that's the strength of it. The presentations are kind of to stimulate the discussions, but really the idea behind the whole conference is it's the back and forth with these high level faculty. And when we say tell all, we're talking about off-label uses. A lot of times we're talking about being really honest about certain procedures or products and what works, what doesn't work. The idea is that we put out highlight videos from the Tell All Tribune, but we did not put out the full video. And the idea being that there was some stuff that stays behind closed doors.
Yeah.
So it was really fun in that regard. This year, it's going to be on June 20th in Fort Lauderdale. We have opened it up to a limited number of paid attendees this time. So there will still be that faculty. It'll be about 30 faculty this year, and they'll still be, at the round tables in the front of the room doing the group discussions there. But there will be an opportunity for people to come kind of be a part of it and listen in on all this. And it's exciting. We're working again with Dr. Shino Bay Aguilera is one of our co-course directors, and he's just a blast to work with. He's a lot of fun, but he's also one of the smartest people you'll ever meet, and
yeah,
just hardworking. Just puts so much into this show. And then Dr. Julie Woodward is his co-director this year, and both of them just have helped us put together just an awesome program that we're super excited about. And then the next day is going to be in the same place but totally different meeting, is going to be Genesis, which is our aesthetic regenerative medicine meeting. That was in New York last year for the first time, and we just decided to put them both in the same place this year to kind of have some efficiencies. We have a small handful of faculty crossing over, but it's mostly different faculty. And Genesis it's open to anyone, can register to attend that. Any clinicians, I should say, and guests. But we have scientists up on the podium in addition to our clinicians, and just the emphasis of that meeting. It's engaging. We welcome group discussions there also, but the emphasis is really on the science and on practical applications, and really being really serious in terms of, let's give people information that they can apply. Let's provide the latest cutting edge advances in regenerative medicine, but B, let's make sure that we're not just talking. Let's be sure that we're giving people something that they can use. So that's June 21st, and again, Dr. Shino Bay Aguilera is co-course director of that one, also along with Dr. Doris Day on that one. So again, we have a lot of just some of the scientists who are doing some of the most interesting things in this field, whether it's exosomes, biostimulators, stem cells, just all these regenerative medicine advancements that are just fascinating, and it's the future. It's really the future of aesthetic medicine, I think.
Yeah, that's so cool. I feel like regenerative medicine is one of the coolest parts, honestly, within like the aesthetic and really the medical industry in general. Honestly, it's just so fascinating to me, and I'm sure you feel the same way about it. What are you kind of most excited for with some of the advancements? And it can be in regenerative or any other type of medicine within kind of the dermatological and aesthetics industry.
Yeah, I think regenerative medicine, number one, and that's obviously, I mean, we're talking about reversing aging. We're talking about, we're talking about aesthetic treatments really going, not to say that some of the, I don't want to say superficial, but not to say that some of the more traditional treatments are going to go away, but we're getting to the point where doctors can really address the root causes of some of the symptoms that were being treated. So if you're talking about wrinkles and treating that with Botox, then so now they can address wrinkles at the cellular level and really stimulate cells in the skin to rejuvenate themselves. So it's really interesting. I think a statement was made last year that actually at the Tell All Tribune, I think a statement was made last year that within the next 25 years we will likely be able to literally reverse aging. So that's really fascinating. And then I think on the medical side, I mean, listen, there's regenerative medicine is important on the medical side, number one.
Yeah.
There are a lot of conditions, medical conditions. There was actually a drug that was just announced today that the first patient was dosed in a phase 1 clinical trial, and the list of conditions that they had, both on the medical and aesthetic side, that this could help address, it was for cellular rejuvenation, and it's just the possibilities are endless there. But then also on the medical side, the biologic drugs and systemics like JAK inhibitors, where our chief medical editor, Dr. Neil Bhatia, loves to say, we're at the point where we're no longer cleaning up the mess, we're instead turning off the faucet.
Yeah.
That's just, I this is my take. Take this, with a grain of salt, having been in this industry for a year, but it seems to me that we're only cracking, we're only in the surface with these
Yeah.
biologic drugs. Some of the presentations that I've seen at conferences about mechanisms of action and the research that's gone into how exactly these drugs target certain pathways and whatnot is just they're just getting to points where what they can do today in treating some of these conditions is just was unheard of even 10, 20 years ago, I think.
Yeah, no, definitely. And I agree with you. Yeah, I think it's fascinating how much the regenerative side of medicine can do for us aesthetically, but also internally as well with the different anti-aging properties. And I feel like it's a pretty new side of medicine, or it's like new for people to be talking about too. Like obviously these things have been around for forever, but we didn't understand the capacity and what they could do.
Yeah, for sure. Modern Aesthetics, our May June issue that's coming out in the next couple weeks. The cover package is about aesthetics and wellness, and I had the privilege of interviewing a couple doctors who are really focused on that, and one of them made a statement that that most aesthetic practices are not yet embracing this, but it's starting. That we're starting to get to make some progress. And again, it's about the underneath. It's about wellness. It's wellness leads to better aesthetic looks, better superficial looks. So there's ways to go there. Obviously there's all the regulatory considerations and so much in development,
Yeah.
but there's just so much potential. When you talk about, you can get all the Botox and filler and facelifts and whatever else, and if your body underneath is not healthy, then even on day one, you probably won't look as good as if your body was healthier underneath. But certainly a few years down the road, that overall wellness is going to help some of these aesthetic treatments even endure more.
For sure. Yeah, and I feel like people are starting to, I mean, not starting to, but it's more of a topic of discussion of the internal wellness side of things and how what's going on underneath, like even your gut biome is going to affect how your skin looks. Like most of the time, if so you have like a skin problem, like you probably have a gut problem too. Obviously, not in all cases, but a lot of the time you can kind of point to those things. So it's very interesting. And I feel like a lot of people now, too, with the access to information, like what you all are putting out on the web, and obviously, like a lot of other people, too, people are kind of starting to get this access to information as well, whether they don't have to be a doctor to know this now.
Yeah, for sure. And I think people are. I mean, we've run articles about patients are coming in and they're asking for these treatments. What do you need to know? How do you need to position these treatments within your practice? Again, the regulatory side of it is a big piece. We actually, in our Genesis meeting, one of our modules is called Navigating Blurred Lines. And we came on that title for it because it is a matter of blurred lines. It is a matter of, there are lines, you want to be on a certain side of them, but they're blurry. And there's people, I have interviewed doctors who will tell me what they're doing, and then they'll tell me exactly how they'd like me to put that publicly,
Yeah.
because it's not that they're doing anything that's necessarily illegal, but it's just that it's a gray area. So it will be very interesting to see how that plays out in Regen Med over the next few years.
Yeah, well, I think when you're doing anything that's new, sometimes, especially where there are really strict regulations, it does get blurry. It's like, okay, what should we be doing? What shouldn't we be doing? Also, maybe we're doing the right thing, but it's still in that gray area.
Yeah, for sure. I mean, the biggest example being that injections of regenerative medicine, whether it's exosomes, people are injecting things but people who want to be on the really safe side are more using exosomes topically, but they are being injected by a lot of people and successfully from what a lot of people will say. And so it's kind of up to, each practitioner, I think, where they want to be on that spectrum. Do they want to be really, really safe and really covered and not have to deal with any, inquiries or anything? Or do they want to, a lot of people are treating only friends and family in certain ways and people that, are really trusted patients and that kind of thing. So it's, again, it'll be interesting to see where it goes.
Yeah. Yeah, exactly. Like you said, there's a lot of lines right now where it's like people don't really know where they are, what they're supposed to do, what's best too for the patient, because like ultimately that's what every doctor wants, but it's also like you don't want to be breaking laws in the process.
Yeah, and listen, and what the FDA says is best for the patient is not always what's best for the patient.
Exactly.
There's certainly, I've spoken to doctors about there are certain treatments that it can take 20 years to get an FDA clearance on something, and it's tough as a doctor who's pretty confident that a certain treatment is going to be effective, is in the best interest of their patient. They know that they're going to have to wait 15 more years before they can legally offer it. So but it is about the best interest of the patient. So it's about, again, it's about how each doctor, each practice wants to navigate all those challenges, but ultimately the best interest of the patient is always at the top of the list.
Yeah. No, and I feel like it takes people too, like what you guys are doing, where like you're having a conference so people can talk about kind of what they're doing and have that open dialogue around these things where they are a little bit blurry. So that's super, super cool. So as we kind of close out, I would love for you to tell everyone if there's any clinicians listening or anyone who wants to learn more about the conference, let them know kind of where they can go to learn more about the conference, where they can follow you also on socials and your website and all of that stuff.
Yeah, so we are Practical Dermatology and Modern Aesthetics. We're on Facebook, X/Twitter, LinkedIn, and Instagram. So find us on there. And the conferences, tellalltribune.com and genesisarm.com. So it's Genesis for Aesthetic Regenerative Medicine. So there are some good deals as far as, again, the meetings are both on back-to-back days in Fort Lauderdale, Florida at the W Hotels. So we have a deal if you register for both. So yeah, we'd love to see people out there. It's going to be a great time. We'll have a lot of coverage of it afterwards also, as we did last year, but there's something to be said certainly for being in that room and the energy and the opportunity to interact with these leading doctors and scientists who are on the cutting edge, whether it's a scientist who's developing the next regen med treatment or whether it's a doctor who's using that treatment or some other treatment in their practice. These meetings are an opportunity to step up to the microphone and ask a question about that or to network with them at the reception afterwards. It's a lot of fun and just a lot of really, really, really high level information being exchanged.
Yeah, no, that's super awesome. And I'll also include all those links in the show notes too, so people have easy access to it. But I appreciate you so much for coming on. Thank you. It was a great conversation.
Thank you. It was a pleasure. Thank you for having me.